Okay, welcome everybody to this session. My name is Leon Tikly. I'm the chair for today. I'm a professor in education at the University of Bristol, and it's my great privilege to be chairing the session on poverty and COVID in the post-COVID world in Africa. And we have a very distinguished panel of speakers with us today, who I'll introduce shortly. But before we get started, just a few things to mention. First of all, my co-chair today is Lauren Winch. So Lauren, maybe you can wave to everybody. And before I introduce the speakers, just a few words of housekeeping I've been asked to give. So the first is that the session will be recorded and posted on our YouTube platform. It will be embedded in the Bristol Poverty Institute website, and by attending, you are consenting to being part of this recording. So just so that we're all on the same page about that. Please ensure that you have added your name rather than being listed as guest, because this will allow us to monitor who's here, but also to identify speakers. And you will be able to ask questions via Zoom's Q&A function, which can be found at the bottom of your screen. So please do ask lots of questions, and don't hold back. That we anticipate having plenty of time at the end for questions. So we really look forward to your questions. So do give some thought as you're listening to the speakers to what you'd like to ask at the end once all the speakers have had their turn. And of course, please be respectful. I know you will be. All events of this conference are being monitored, and we reserve the right to remove attendees whose comments are deemed offensive or derogatory. But I very much doubt that will be the case today. All right. So first of all, we're going to hear from our hosts at BPI, who will give us a brief introduction to the Research Institute and the conference. So over to you, Lauren.
Hopefully you can see my screen now and hear me, but do shout if that's not the case. So as Leon said, my name's Lauren Winch, and I'm the manager of the Bristol Poverty Institute, who are hosting this conference today, as well as our in-person day yesterday. Just apologies for those of you who are attending multiple sessions today. We are giving the same introduction because we know some of our attendees are only coming to one of these. So apologies if you've heard this before. I will keep it quite brief. But we've got plenty more information on our website and other channels if you want to find out more about us. But in summary, the Bristol Poverty Institute was launched in 2017, and we're an interdisciplinary research institute whose role is to grow, develop and promote the poverty and poverty-relevant research community, both at the University of Bristol and beyond, engaging cross sectors to work together to end poverty in all its forms everywhere. And something that's really important to us is to get people to consider those poverty relevant aspects of their work, even if poverty isn't a central theme of what they're working on, because there can be great potential for positive impacts, but there can also be potential for unintended harmful consequences. So that's something we really work with to drive forward. So all of our work is driven by our mission to explore the interface of different social, political and environmental dimensions of poverty, with the ultimate aim of translating our research on the causes, effects and measurement of poverty into evidence-informed policy and practice, which drives forward social justice. So this conference itself is a hybrid event over 2 days, balancing the benefits of in-person engagement with the accessibility of online events. Our aim was to bring together a broad multi-sector audience to explore how the pandemic has impacted on different dimensions of poverty. As we all know, the pandemic wreaked havoc across the world and disrupted all of our lives. New inequalities emerged and existing inequalities were exposed and exacerbated, and many of these have persisted long beyond the peak of the pandemic. And whilst the title of our event talks about a post-COVID world, this is with recognition that COVID is very much still here, affecting lives and resulting in premature deaths. So the focus of the conference really is therefore on dimensions of poverty in today's world, which is a world that's been shaped and impacted by the pandemic in various ways. We therefore need to understand all of the different ways the pandemic has impacted on our societies and what can be done to mitigate the negative impacts and harness the opportunities. And that's why we're here today. So we started yesterday with an in-person day that had a UK focus. And today we're basically following the sun around the world, shedding light on poverty in different regions. And obviously the session now is on Africa. So we started this morning with a session exploring Asia and Oceania, then moved on to Europe. We've got our Africa session now, and then we'll be wrapping up the day with a session on the Americas, so both North and South America later on this afternoon. So please do join us if you're able to, and do get in touch if you've got any queries for Bristol Poverty Institute or what you've heard has inspired you, or you want to speak to the, get in touch with the speakers. And as Leon mentioned, we'll be making the resources from the conference available on our website in due course. So do check back on that if you want to download presentations, watch back a recording, or if you've really enjoyed a session and want to share the recording with a colleague who you think it might be of interest to. So I'm going to hand back over to Leon to share our session now, and hope you all enjoy it.
Wonderful. Thank you, Lauren, for that marvelous introduction. We've got 4 speakers today, and we've got a slightly different running order. We're going to go with Dr. Nkechi Owoo first, and then that's going to be followed by Professor Murray Leibbrandt, sorry, and then we're going to have Dr. Cynthia Fonta, and then myself. So, but we're going to start with Dr. Nkechi Owoo, and her talk is on spatial and regression analyses of climate shocks and household food insecurity in Ghana. Dr. Owoo is an associate professor of economics at the University of Ghana. She also holds a number of local and international visiting research fellowships and positions. But without further ado, I'll hand over to you, Nkechi.
Thank you very much, Leon. And so I'm happy to start my talk, which is titled Spatial and Regression Analyses of Climate Shocks and then Household Food Insecurity in Ghana. And I'm giving you just a brief outline of what this talk will comprise. Now, when we talk about food insecurity, this is a very important issue for any country because it has implications for its nationals' human capital development. You can see its influences through health outcomes, through labor force productivity of nationals, through earnings capacity, and ultimately through household or individuals' poverty status. Now, there have been a lot of studies that have already identified the importance of individual, household, community, and the national factors that explain or determine households' food security status. But it's also important to emphasize that threats posed by climate change and related shocks also have the ability to disrupt food systems and increase food insecurity. And this can happen in along a number of different channels. So for example, disaster events can affect food production, for example, directly through changes in the agroecological conditions necessary for growing food. We can also have situations where shocks or disaster events cause food prices to rise and therefore lead to increased malnutrition as a result of lower affordability of these food resources. As a result of climate change, we could see higher temperatures contributing to faster food spoilage. We could see high humidity levels that, encourage the growth of fungal infestations on food, or flooding events that cause mold to develop on crops that may be sitting on farms, for example. And then finally, we have already had issues of, forced displacement and migration of people from their countries or communities of habitation where they may have been engaged in food production. And when they move on to their other communities of destination, they may become more susceptible to food insecurity if they don't have access to these farmlands or other opportunities to cater for their food needs. Now, there has been evidence of the effects of climate change and disaster events affecting food insecurity across the African continent. In South Africa, for example, we had the work by Bristol and others that showed that a drought led to increases in food prices with devastating effects on availability of food. In Nigeria, Akukwe and colleagues showed that as a result of flooding, households were forced to switch to less nutritious foods. The paper by Ajero in 2017 indicated that some of these effects of climate shocks on food insecurity may be gendered. In the Nigerian situation, female-headed households experienced worse outcomes because they had lower access to, good farmlands, and there were also the presence of gender norms, which made it difficult for these individuals to seek alternative employment opportunities after the devastation of their farms. There are other studies that we can see that have shown the connections between climate change and then food insecurity on the continent. If you look at studies by Adeseti and others, Afo, and also Bedasa and Bedemo. So we do see some studies relating to this. And then my focus in this paper is on Ghana for a number of reasons. Because in recent times, we are seeing the occurrence of a lot more natural disasters and climate shocks. Indeed, we are seeing a majority happening in the past decade alone, with the most common disaster being flooding. Now, according to the country's statistical office, we are seeing close to half of Ghanaians experiencing food insecurity in early 2022, with as many as 12% of Ghanaians experiencing severe insecurity. Indeed, the research on linkages between climate shocks and food insecurity has been growing over time, although there still is room for improvement. And this is for a couple of reasons. Well, first of all, we tend to have a scarcity in access to disaggregated climate shocks data, and this has led to small and localized explorations of these connections between climate shocks and food insecurity. And although these studies are indeed very useful, there's of course limited implications for inference beyond these small communities that these studies are carried out on. Secondly, there's also limited nationally representative data on food insecurity indicators, and this has meant that a lot of the existing studies have instead proxied food insecurity by crop production or crop productivity. Now, as we may know, one may not necessarily imply the other. You can have a country that has low agricultural production, but still be food secure if importation is high. Or another country may be food insecure despite high food production if access or distribution is inequitable. Now, in this paper, I have explicit research questions that I ask. So one of the objectives is to try to illustrate the spatial relationship that exists between household experiences of climate shocks and then food insecurity as well, so that we can pinpoint exactly what communities or districts have this overlap of experiencing shocks and are also characterized by food insecurity. Using regression analysis, I'm also interested to see to what extent these climate shocks are related to different categories of food insecurity, mild, moderate, and severe. And then also, as a secondary objective, look to see whether the relationship between climate shocks and then food insecurity depends on the household status, household poverty status in my sample. Now, the study makes a number of contributions to the existing literature. I've already talked about some of these. It would be a first attempt at a countrywide analysis of the linkages between climate shocks and food insecurity using nationally representative data. I would also be interested in exploring food insecurity using actual indicators rather than just food production or productivity proxies. I'm looking to see how these relationships vary by household poverty status. And as I mentioned, the spatial analyses will present visual illustrations of overlaps between food insecurity, and then households or districts experiencing climate shocks. Now, I'd like to talk a little bit about the data that is used for this analysis, and there are two main data sets used. The first is the most recent wave of the Ghana Living Standards Survey collected in 2017. This is a nationally representative survey, including about 14,000 households and more than 60,000 individuals. And even though we have had waves of this data set collected starting from the 1980s, I believe, it is only in this wave that we had information collected on food insecurity. And I'm showing an excerpt of this to the right of the slide, where a knowledgeable household member was asked a total of 8 different questions about the food security status of the household, ranging from mild to moderate to severe insecurity. So, for example, for mild insecurity, the first question asked whether that individual or others in their household worried about not having enough food to eat. With respect to questions on moderate insecurity, the fourth is an example, asking whether there was a time where people in that household had to skip a meal because there wasn't enough money to buy food. Or an example of a question on indicating severe insecurity. The seventh one was a question about whether there was a time where people in the household were hungry but did not eat because there wasn't enough money. So these questions are then used to construct indices used in the analysis. I'll talk about this in the next slide. But then the second main data set used is the data on climate shocks. And this is obtained from the Geocoded Disasters database. And here, for an event to be classified as a disaster or a shock, it has to have satisfied at least one of these criteria. So there has to have been 10 or more people reported killed as a result of that event. 100 or more people have to have been affected through, for example, destruction of farmlands or property. There should also have been the declaration of a state of emergency or a call for international assistance. Now, on this slide, I'm showing quickly how I constructed the variables used in the analysis. So for food insecurity, there were 3 indices that I used for this paper. So the first was simply using a weighted average of yes/no responses for each household across the different questions that I just told you about. So we can have, therefore, scores ranging from 0 to 1 across the mild, moderate, and then severe categories. And then I also do this for all of the questions. Again, this would be ranging from 0 to 1 with higher scores indicative of greater food insecurity. The second index simply summed up the responses for the different food security questions or indicators for each household, again, across the different dimensions. So there were 3 questions asked each for mild and moderate insecurity. So a household could score 0 if they were not vulnerable in any of those indicators, or they could score as high as 3 if they were vulnerable and they answered yes to all of those questions in the mild and moderate categories. And then there were 2 questions asked for severe food insecurity. So households could have scores from 0 to 2. And then there was also, finally, consistent with the existing literature, again, overall intensity of food insecurity, where scores are summed up across all 8 questions and therefore ranged from 0 to 8. With respect to climate shocks, this was measured as the number of events that households reported experiencing in their districts in the 3 years preceding and including the year of the GLSS 7 data collection. Other studies have used a 5-year window in the past. I have elected to use the 3-year window because I feel as if the experiences of climate shocks would be closer to the household's present experience of food insecurity. So that window or time frame suits me better. Now, with respect to the methodological strategy, I employ 2 main ones, spatial and then regression analyses. The spatial analyses entail the use of bivariate leases to indicate the nature of the relationship between climate shocks in a neighborhood and then food insecurity. So we could have positive or negative spatial autocorrelation. Positive being a situation where households that experience shocks are also food insecure, or those that do not experience shocks are not food insecure. Negative autocorrelation being present if households don't experience shocks, but are characterized by high degrees of food insecurity, and vice versa. With the presence of negative spatial autocorrelation, this may suggest then that there could be other factors that are influencing food insecurity within a household. And this is where the regression analysis comes in, where we use both OLS and then the ordinal logic model, depending on how the food insecurity indices have been constructed, to see whether any relationship between shocks and then insecurity persists even after we control for all of those other potential determinants of food insecurity. Now, on this slide, I would like to show the results of the spatial analyses. And there were 8 questions asked on food insecurity, but I'm just showing an excerpt, just 3 out of those 8. The full 8 are in the paper draft. But generally, the patterns were consistent across all of these questions. So on these maps, I'm showing the relationship between climate shocks and then different dimensions of food insecurity. And as soon as you look at the graph, you can see that there's some evidence of positive autocorrelation indicated by these red dots found mostly in the northern parts of the country, and also by these dark blue dots. Now, these red dots, what we call the hotspots, are areas that have a high incidence of climate shocks and are also characterized by high degrees of food insecurity. The areas of blue dots, or the dark blue shaded dots, are areas found mostly in the southern parts of the country. They are areas where the experience of climate shocks are low, and then food insecurity is also low. Now, in addition to this positive locational relationship between climate shocks and insecurity, there is also evidence of negative spatial autocorrelation. And this is found with these pink dots and also these purple dots that you can see mostly in the northern parts of the country. Now, these pink dots are found along the coast, mostly in the Greater Accra region, particularly in Accra. And these are households that have experienced climate shocks, but are characterized by low levels of food insecurity. And then in the northern parts of the country, you have these purple dots, areas that, again, haven't experienced a lot of climate shocks, but are characterized by high degrees of food insecurity. Therefore, as I mentioned before, suggesting that there's the presence of other factors that may explain the prevalence of food insecurity in the area beyond just climate shocks. And this is where we turn to the results of the regression analysis. And here we control for, as prescribed by the literature, a whole lot of other variables that have a potential effect or have a determining effect on food insecurity. And even after all of these are controlled for, we still see a positive and significant relationship between climate shocks and the different indices of food insecurity, whether we use the ordinal logic model or the simple OLS regression models. As I mentioned before, a secondary objective is also to see how this relationship changes or matters based on whether households are poor or non-poor. And when you look at the first 2 results, we see that, as expected, the effect of climate shocks and household poverty, there's this positive association between these variables and then food insecurity. However, the additional effect of being poor among households that experience climate shocks is to reduce the correlation with food insecurity, which at first sounds counterintuitive. The way that I rationalize this is that there perhaps is these households, poorer households, may be benefiting from certain social safety nets available in the country, like the Livelihood Empowerment Against Poverty program, which could be providing a cushion for these poor households in the event of climate shocks, and therefore reducing their exposure, if you will, or their experience of food insecurity in the event of these shocks.
Nkechi, 5 minutes.
Yes, very good. This is my very last slide. So I'm just going to summarize the results I've already told you about. So I found that climate spatial analyses showed that food insecurity is indeed correlated with geographical locations of climate shock events across the country. Even when we control for a bunch of different factors that are important for food insecurity, this positive relationship still continues to be present. I didn't show the results from the other control variables in the interest of time, but I'm happy to summarize the significant ones here. So resilience factors to food insecurity included male household headship and also educational status within the household. Risk factors included large household sizes, unemployment, and interestingly, households involved in fishing and then farming activities, as well as poorer household statuses. As I mentioned, the effect of climate shocks on poor households' food insecurity was lower compared to non-poor households, but this is likely because of the availability of social safety nets like the LEAP program and also other NGOs or actors in these areas that may again be providing assistance and cushion for poorer households that cushions them against these negative food insecurity outcomes in the event of climate shocks. Thank you very much for your attention, and I look forward to your questions. Thank you.
Thank you very much, Nkechi. That was for that wonderful presentation. Really very thought-provoking and disturbing at the same time, but also very, very informative. So thank you for that. Okay, well, next up, we've got Professor Murray Leibbrandt from the University of Cape Town. Murray is the University of Cape Town Chair in Poverty and Inequality Research and served as the Director of the Southern Africa Labour and Development Research Unit at the university from 2002 until 2023. And Murray will be talking to us about inequality and poverty through the prism of a pandemic, COVID-19 in South Africa. Over to you, Murray.
Thank you. Am I showing my presentation, Lauren?
You are, yes.
Great.
Oh, actually, I don't know. I don't think so. I can't see it at the moment. I'm just seeing
I could see your screen, but it was the event page rather than your presentation.
How about that?
Yeah.
Yes. That's it. That's the one, Murray.
Okay, wonderful. It's such a privilege and a pleasure to be with you today. It's early morning on the west coast of America, but a lovely morning. And I today want to talk to the work that the African Centre of Excellence for Inequality Research has done with the Bristol Poverty Institute as a way of celebrating our partnership, but also to try and give people a sense of this quite unique interaction between top quality, research and actual involvement in better policy making for the people of our continent that we've had the privilege of forging together with the BPI. The African Centre of Excellence for Inequality Research is one of the centres of excellence within the African Research Universities Alliance, which is an alliance of the top research universities in Africa. And our particular mandate is to take responsibility for leading the discussions on key poverty and inequality issues on our continent. And over the course of our 5 years that we've been alive, we've forged a very close working relationship with the BPI. So today I want to the introduction part, you're well through it already, is really just to introduce the centre. And Nkechi, the centre has 3 nodes: University of Cape Town, University of Ghana, and Nkechi Owoo is one of our stars from the Ghanaian node, and the University of Nairobi. And we have tried to do our work by generating data and doing analysis that is close to the key policy issues of the day. And so Nkechi's paper was speaking about the climate change and climate change shocks, and we've been involved with Bristol on work in that area. But obviously the COVID pandemic was something that gave us a unique opportunity to be valuable. And I want to talk about that today with two aspects to my talk. One was to introduce you to some vulnerability indices that we generated with the University of with Bristol and with Dave Gordon and around the continent. Really, I'm going to talk to the South African example, and then I'm going to talk to a tracking survey that in the South African context we ran that tracked the impacts of COVID. So one is the profiling of COVID, and then moving on to the tracking. I'll have to keep clipping along. When the pandemic struck us, given the strength of the Bristol Poverty Institute, they were immediately into action in terms of profiling vulnerability to COVID in Africa. Everybody around the world kept saying, okay, this is really surfacing our inequalities and our vulnerabilities. But for that to be useful to policymakers, one had to actually use the great strength that the BPI has in the development of indicators in order to map and profile and show vulnerability. So very early on in the pandemic, Dave and a large team of people started practicing their art, really, but to huge impact. And we locked into that work. We were fortunate enough to be part of that paper that I just showed on the screen. And but then we took it to each of our country contexts as well in ASA. And so the aim of that work then was to, of course, identify individuals at the greatest risk of contracting COVID-19 due to their living circumstances. So to bring the socioeconomic side alongside the non-pharmacological, as this is a slide I stole from Dave, interventions. And the purpose of that was really to say, okay, where are these gaps and what can the socioeconomic policy side contribute to the pandemic? What I want to flag is that the art and the research strength of the work in the BPI is to tailor indices that are tailored to the task at hand. This is what I'm putting before you are the indices. We would be looking for indices to profile the things that are in the circles there, because those go to COVID vulnerability. And that's grounded in a careful discussion about the spread of the disease, actually. And so there are a number of indicators here that would be obvious because they tie in to social networking, but they also tie into what you can do inside of your household about that. And so you've got to then take these to the data and profile the vulnerability to COVID-19. And in South Africa, we did this using the 2019 General Household Survey. I don't want to get too much into the detail of that. But the key point, what we've learned from working with the BPI anyway, is even though we landed up entering the policy dialogue space with some sort of average vulnerability index, there's a nuance behind that that describes each of the indicators and the vulnerability profiled by those. It's a very rich thing where the average vulnerability index doesn't just dominate the whole show. Obviously, in the poverty area, both, the BPI has been doing this for a long time, world champions in some senses. And so what do you get out of that? Well, here's just a map that comes out of those survey data that profiles, with the red being a very high vulnerability, aggregate vulnerability to the indicators. And a point I'd like to make about that is that this maps onto, of course, poverty vulnerability, but it's not exactly the same thing. It's tailored to the purpose at hand. And so you can talk directly to the policy people But this is more at this level, that's more useful in terms of making sure that policy is directed where it's needed in the country in a big purpose sense. But it's not particularly useful in very precisely targeting policy. But nonetheless, we were able to take it to data sets, and here one has to use the census, but in South Africa, we also have a very large community survey where we were able to then dive inside those areas of vulnerability to very useful effect. Just one example here is this was the province, the Eastern Cape, that was most vulnerable province. But what this shows is that within that province, those pockets of extreme vulnerability are much more focused than that. And it was we were able to bring that into the national discussion. And so through that sort of work and around the continent, this same type of work was able to show that that you can have World Health Organization regulations and you can have national policy lockdown things, but at the same time, a large proportion of the population, their lived reality is such that they can't really implement all of these things across space and the way that they live and the informal settlements across Africa in particular. We were able to surface as particular areas of great vulnerability where they were we share water in these areas, we live right next to each other, very crowded households, etc. And so the point was that the containment measures that were being put in place may not work as intended, and indeed they weren't. So I'm asking you to straddle two different areas that I'm covering quite quickly. Those profiling exercises were very important in South Africa. At the same time, we were asked to lead an exercise because we'd been running a national longitudinal study in South Africa for quite a long time, since 2008. It was an available vehicle for government to use to track the socioeconomic impacts of the COVID pandemic. And we quickly geared up the panel. Obviously, we couldn't do in-person interviews anymore, but you could do telephonic interviews to track the impacts of the pandemic. And it was a national research. It was a lovely contribution from the national research community into trying to cope with this incredible shock to the system. And so here's a map representing the flow of the pandemic, in a sense, across its waves. You can see the daily cases. That's the black line. So this is the pandemic unfolding through from its start in March and April, and we ran 5 waves of this survey through the pandemic. Those are shown in the orange. My colors aren't so great. I hope it looks like orange to you. And you can see, so 1, 2, 3, 4, 5. The graph also puts in place, you can see in the gray, public school closures. So those were the sort of the signals of the lockdowns, and then every so often we'd have another brief lockdown to try and cope with the pandemic, because the vaccinations only arrived in South Africa in 2021. And so we were coping with a pandemic not through vaccination over this period. And ECD closures are the closures of early childhood development centers and the closures of schools. That represents our attempts to lock down, if you like. Okay, so we've got the study going, but even before, in March of 2020, as the pandemic was striking, we had the privilege of working with the South African government to try and determine the emergency relief measures. And we were able to use our data and what we put in place as researchers. We were able to leverage it to run some scenarios as to what sort of measures government could implement to buffer the socioeconomic impact of COVID, in particular on informal workers who weren't being taken care of with the other labour market interventions that government put in place. And we ran some scenarios of topping up the social grants that government already has in place. South Africa has a very strong social grant system. There's an old age pension with a broad reach, a child support grant with a broad reach, hugely broad reach. And then we also simulated scenarios of a new grant that government could put in place. And that was quite important in government then forging its response. They topped up the grants, not exactly the way the simulation implies. The simulation implies that the child support grant was the one that would have the biggest impact. Government actually implemented something where they topped up both the old age pension and the child support grant. And then we started working to put in place this other grant targeted at those the unemployed and those who'd lost their jobs because of the pandemic, the informal workers. And so what government put in place over 4 months was to basically bring 4.2 million people onto something, this COVID-19 social relief of distress grant, and basically with the top up of the grants, more or less doubled what South Africa had been doing in social protection. But obviously that was an emergency relief, and it was the COVID-19 grant that was specially tailored. So we topped up the grants, and then we started tailoring this emergency relief grant.
Murray, got 5 minutes, please.
Thank you. That's a very good prompt. So decades worth of grant growth accomplished in 6 months. But the point is, what's the impact? And it was really the NIDS-CRAM study that could track the impacts. And so I'll just give you 2 quick examples here. The study, a 20-minute telephonic survey, but it could track hunger across the pandemic. And so you could see the hunger spike in South Africa at the onset and with the lockdown. Those are the high bars. But then what these graphs show is the flow of that across the pandemic. And I just want to make one key point here, that that emergency relief, the top-up grants were faded away, and then the COVID relief grant, government withdrew the funding because it's expensive here in between after June 2020. And so, there's an uproar about that, and government was very worried about locking themselves into a very big protection measure that they didn't have before. But what we were able to show by when you take away the grant, you can see the impact of the grant. And so you can see poverty spiking here, and that was really, really very influential in government extending the grant repeatedly over time. And it remains in place today. And that's a point that's really where I want to finish my presentation. I show mental health too, and we track the mental health, and we were able to show the pressure on vulnerable households of actually coping with the pandemic. It's a crucial dimension. But as I was saying, through this work, partly to show how incredible a 350 Rand per beneficiary grant, which is extremely low, benefited people and how they made use of it, then made the case that we need to think about this, about mainstreaming this going forward. Because we have a very high unemployment society, we have a very vulnerable society anyway, that COVID shook, but there's aspects to the vulnerability that it just added to. So a lot of work has been done subsequently. I'm just on the graph here, some work that we did as part of a government-initiated expert panel to look at how we could mainstream and what the costs would be of mainstreaming that grant. It's still in place. Treasury are very worried about the cost of the grant, and so they haven't been enthusiastic. But we've been able to do a lot of good work to show, okay, what are the best options? At the same time, obviously, the pandemic had an employment impact that I haven't discussed at all today. But really, the ballgame about this protection has been about how to harmonize labor market shocks, which was what COVID caused, as well as the normal social protection, poverty, hunger, inequality shocks. And let me finish. So I don't want to go through this, but there was a huge labor market shock in South Africa. Let me close out the presentation then by some thoughts about going forward in the spirit of the conference, really. So what did we learn? We learned that that you need good data, and the fact that you've got something like the Bristol Poverty Institute in the context across the world we're having these discussions today becomes a moment where you absolutely have a key role to play, and COVID was such a moment. But you need the good data, you need the research capacity in place, and you need, I've shown you also need the world-class capacity to do that. But then you also need the political and social engagement, because it's that interface. You need real-time data, but that's quite difficult, and we've got a number of papers today about that. But my key point then in closing is it's very hard to mainstream policy lessons, even extremely positive ones, about how a teeny grant really was used incredibly by very vulnerable people. It's very hard to mainstream it, but in the South African context, it never went away. And we're now in this much more open discussion about the harmonization between social protection policies and active labor market policies that fully recognizes the lived realities and intersecting vulnerabilities. So great credit to the work that the BPI has been doing for many years. Thank you.
Thank you very much indeed, Murray, for that wonderful presentation. Really lucid and comprehensive and extremely interesting. And it's great to see how you've connected in with the work of the BPI, and very much hits the theme of today's conference. So thank you very much for that. Okay, next up we have Dr. Cynthia Fonta, who is now a doctoral student at the School for Policy Studies at the University of Bristol. And Cynthia will be talking to us today about a cross-comparative analysis of child poverty across sub-Saharan Africa, the case of Francophone and Anglophone African countries. So over to you, Cynthia.
Thank you, Prof. Hi, everyone, and welcome to this presentation. This is part of my PhD thesis. My supervisors are Professor Gordon and Dr. Zoe. And here's my research outline. So for over decades, legally binding international frameworks like the United Nations Convention on the Rights of the Child and the African Charter on the Rights and Welfare of the Child have been very crucial towards mobilizing countries in the fight against poverty and improving the living conditions of children. Poverty is not only measured in monetary terms, but also as a condition characterized by severe deprivation of basic needs such as water, sanitation, access to food, access to shelter, education, information, and all that. The MDGs and the current SDGs have made immense progress towards improving certain development outcomes, especially around the world, not just in Africa. We focus this research on Africa because development outcomes have been slow. For example, countries like Niger, Nigeria, Chad, Sudan have very high child under 5 mortality rates of about 112 deaths per 1,000 live births. Efforts will need to quadruple for them to achieve the set SDG targets of 25 child deaths per 1,000 births. Again, if we look at sub-Saharan Africa, it's lagging behind in average literacy level. Average life expectancy is lowest compared to other regions. There is rising the number of people living below $2 a day. It will be difficult, of course, for low-income families to provide these basic needs of water and sanitation, the most basic needs that other countries take for granted. And so it begs us to ask the question, Why has underdevelopment persisted in Africa? Why has there been rising inequalities despite all of these development efforts, development initiatives, foreign aid? Underdevelopment has still persisted in Africa, and poverty is rising. There are a myriad of factors. We can group them into external and internal factors. Some scholars associate underdevelopment in Africa to colonial legacy, which they believe shaped the social, economic, and cultural landscape in the region. Also, the Washington Consensus, which promoted neoliberal policies such as foreign direct investment, market liberalization, urbanization. This, to some, has led to economic dependency and resource extraction in some parts of Africa and widened inequalities. Again, the structural adjustment programs that have cut back on welfare spending in most countries and reduction in salaries and unemployment rates have gone up. It's difficult for the common man to provide certain basic services for themselves. Internal factors in Africa, of course, corruption, the weak institutions, repeated conflicts, tax mismanagement, failed policies. In some countries, there are some misplaced priorities where government expenditure is focused on buying a lot of cars to politicians and doing other things, fighting or conflicts, when such resources can be used to improve the living conditions of children. However, we focus on colonial legacy because this is where my work is centered on. The British and the French colonized a bulk of African nations, and they implemented different styles of rule. For example, the French system instituted a direct system of ruling where they concentrated the legislative, executive, and judicial powers to the central system of governance and only among certain ethnic groups in the central regions. Of course, development will be lagging in peripheral areas. Or on the other hand, the British instituted an indirect system of ruling where they focused on more decentralization of power and resources to the peripheral areas, to local communities. So we hypothesized that development would be better within Francophone than Anglophone states, owing to their differences in their inherent colonial structures. And so we asked the following research questions. What is the extent of child poverty in Francophone and Anglophone states? Again, are within country disparities in child poverty narrower in Anglophone than in Francophone Africa? To answer these research questions, we pulled indicators from the DHS surveys between 2000 and 2019, the Gallup World Poll, Barrow and colleagues data, education data mainly, and some world development indicators. We also used the World Health Equity Assessment Toolkit to measure inequalities. So for the child poverty measurement, we applied the rights-based approach to poverty, also known as the Bristol approach, which was conceived by Professor Gordon and his Bristol colleagues about 20 years ago. Here, they use internationally defined indicators to measure poverty, and they define child poverty as severe deprivations of 2 or more dimensions of basic needs. In this study, we are going to define poverty as children who suffer from moderate and severe deprivations, because children who are moderately deprived are also compromised in their health outcomes. And so we are going to measure these indicators and dimensions as they are, without necessarily forming an index, to avoid the complexities of weighting, and also to avoid to look at the individual dimensional effects or individual effects, so that we don't mask the effects of another. And for policy, it will be better for policy targeting. So you have water poverty, sanitation poverty, and dwelling poverty, information, nutrition in terms of diverse diets, and single anthropometric failure and multiple anthropometric failures. Health includes vaccine uptake and medical access. All these dimensions and indicators, I can't go into the details on how they're measured, but if you need further information, you can send me an email. For the between country assessment of poverty, we used ANOVA models to compare the mean child poverty between the two colonial contexts. For those indicators and dimensions that did not meet the model's assumptions, we proceeded to compare the medians, to use a non-parametric measure to compare the child poverty medians. We also used risk ratios to quantifiably establish if these differences were sufficient enough between the two colonial contexts. Now, for within-country analysis, we disaggregated the data into subnational and administrative regions and calculated child poverty within the two regions. And we defined we defined this as a regional inequality, absolute regional inequality. Again, we ranked children according to their wealth quintiles from the least advantaged to the most advantaged, specifically for the health and nutrition indicators. For the relative measures, we use the relative index of inequality, which is the ratio of the predicted child poverty mean of the most advantaged child to the predicted child poverty means of the least advantaged child. We went further to have a more robust pictures of inequalities. We also calculated absolute socioeconomic inequalities using the slope index of inequality, which was the difference in predicted child poverty means between the most advantaged child and the least advantaged child. Now, for the absolute measures, the regional inequalities and the SII, values that were close to 1 indicated inequalities were wider, and values that were close to 0 indicated lower inequalities. For the RRI, it was a reverse. Values that were close to 1 indicated narrower inequality gaps, and values that were close to 0 indicated wider inequality gaps. We also used regression analysis to determine if there were child poverty differences between colonial contexts while controlling for urbanization as well. The weighted statistics, over 900,000 children were sampled, 51% from Anglophone states and 49% from 51% from Francophone states and 49% from Anglophone states. The only interesting thing here is a lot more mothers in Francophone states were uneducated. About 67% of mothers were not educated in Francophone states compared with Anglophone mothers. Now, for the child poverty mean differences, we can see the very high rates of sanitation poverty in across Africa in both Anglophone and Francophone states. Most of the dimensions and indicators were higher in Francophone African countries than in Anglophone African countries, but for the single anthropometry failures and the moderate and severe food insecurity. For the child poverty median differences, we also noted that multiple anthropometry failure was higher in Francophone states than in Anglophone states, and water poverty was almost the same. The medians of incomplete schooling was and dwelling poverty were higher in Anglophone than in Francophone states. However, we needed to establish if these differences were substantial enough to conclude that colonial differences impacted child poverty. The base case here are the Anglophone states. So children in Francophone African countries had a higher risk of low vaccine uptake, no formal schooling, and low medical access compared with Anglophone children.
Cynthia, I'm sorry to interrupt you. Would you be kind enough to put your presentation in presentation mode? It might make it a bit easier to see.
Oh, sorry. Can you see?
Don't worry. Thank you so much.
Oh, sorry about that.
Don't worry. You're doing great. Thank you.
Okay. So Francophone children have a higher risk of low vaccine uptake, no formal schooling, and low medical access compared with Anglophone children. These were statistically significant. On the other hand, dwelling poverty, single anthropometry failure, and incomplete schooling were more likely higher among Anglophone children than among Francophone children. But these variables were not significant. They were the same between colonial origin. So the only significant variables were the health, low vaccine uptake, low medical access, and no formal schooling. For the regional inequalities, the pink circle represents the subnational regions, and the green circles represent the administrative regions. Not to dwell a lot on this, if you look at the child-specific indicators, the regional inequalities were much narrower for all the child-specific indicators, the nutrition and health. On the other hand, on my right side of the graph, the household-related dimensions, you can look at you can see the wide regional inequality gaps in all the dimensions: water poverty, sanitation poverty, dwelling poverty. This speaks to how neglected these services have been in the peripheral areas, and so much focus or interventions have been on the health and nutrition, and that's why we have the narrower regional gaps. And so to compare the regional inequalities between colonial origin, in our regression models, we did not find any statistical difference or substantial differences between colonial origin. If you look at residing in Francophone states, however, regional inequalities in sanitation was wider within Francophone than within Anglophone states. But if you look at the adjusted R-squared, which shows the correlations in the model, it wasn't substantial for us to make any claims of differences between colonial contexts. So there were no regional inequality differences between colonial origin. However, when we look at the RRI, remember I said the wider the RRI, the lower the inequalities. A child who resides in Francophone states has a lower RRI in low medical access and low vaccine uptake, which means that the index of inequality was wider. The index of inequality for low medical access and low vaccine uptake was wider within Francophone states than within Anglophone states. Again, urbanization, we use urbanization as a control measure because studies have shown that urbanization increases inequalities in countries. And so urbanization, in this case, increasing urbanization increases the RRI, which meant that increasing urbanization reduces the RRI for low medical access and low vaccine uptake. On the other hand, increasing urbanization reduces the RRI for single anthropometry failure and multiple anthropometry failure, which means that urbanization increases nutritional inequalities. Again, for the slope index of inequality and colonial origins, the wider or higher slope index of inequality indicated wider inequality gaps. So a child who resides in Francophone states, like the previous table, there is an increase in inequalities in health for children who reside in Francophone state compared with residing in an Anglophone state. Urbanization also reduces inequalities in low medical access. And so from this study, we noted that Francophone children were 1.4 times more likely to lack medical access and almost twice more likely to have an incomplete vaccine schedule or lack a formal education than Anglophone children.
Cynthia, 5 minutes, please.
Okay, thank you. Child poverty estimates in relation to household dimensions and nutrition indicators were similar between the two colonial contexts. Again, absolute and relative socioeconomic inequalities in health were wider within Francophone than within Anglophone states. We did not find any differences in regional inequalities between the two colonial contexts. However, what we found was regional inequalities in health and nutrition were very narrow across all the states, irrespective of colonial origin, whereas household dimensions showed wider gaps in inequalities. Increasing urbanization was protective of health inequalities, whereas it increased nutritional inequalities. And so in conclusion, there is, of course, a historical basis as to why health and education indicators were different between the two colonial contexts. And so Francophone African countries must move away from their centralized structure to a more less politicized decentralization and a more service-oriented decentralization process. colonial origins have nothing to do with the supply of household goods. Rather, the strong institutions, transparent decentralization processes, and investment in water and sanitation services, which are very paramount in preventing infectious disease spread, as we have seen in the COVID era. Again, urbanization is crucial to economic growth and sustainable development. However, it must be done in caution, being mindful of incorporating agricultural spaces during urban planning, so as to reduce or mitigate the effects of food insecurity and also reduce other adverse effects of urbanization. So this study ties up to all what the previous speakers have said, that water and sanitation, these are basic goods that have to be provided. We need non-pharmacological measures of preventing diseases, and it starts with country commitment towards ensuring that the most basic services are provided to improve children's living standards and reduce under 5 mortality rates. I think I'll stop here. Thank you.
Wonderful, Cynthia. Thanks so much for that. Really interesting presentation, and it's such an interesting way to think about the issue of poverty in terms of the colonial legacy. So thank you for that. Really instructive.
Okay. I'm really sorry about the presentation. I didn't even. I'm sorry if they weren't following up.
No, not at all. Not at all. No, I think we could see your slides, but it was just that then we could see them slightly more clearly in presentation mode, but we could see them. So don't worry.
All right, thanks.
You spoke so clearly. It was very clear, your presentation. Thank you. Okay, so all right, so it's me up next, and I'm going to try and be slightly ambitious, because I'm going to move between different applications. So so I hope that this works. Now, can you see my presentation, Lauren?
Yeah, it's in the editing mode rather than the presentation mode at the moment.
Okay, yeah. So I have to take a leaf out of my own book now, having asked Cynthia to go into presentation mode. Okay, so all right, so I'm going to talk to you about a project, a network that has just been completed in October of last year. It ran between 2019 and 2023 through the pandemic, and it was called Transforming Education for Sustainable Futures, and it was funded by UKRI, and it involved partners in Somaliland and Somalia. You have to be quite careful about mentioning both of those territories, I've learned, but also in Rwanda and in South Africa and in India. So although it had a largely African focus, there was an Indian component as well, and we funded through this network 67 projects, which was quite an undertaking, I can assure you. We were very lucky to have Dave Gordon as part of our advisory board, and we had people really leading figures in the field also represented. So it was a very exciting network, and we asked about education's role in helping to achieve sustainable livelihoods, SDG 8, education's role in achieving sustainable cities and communities, and education's role in climate action. But we adopted a specifically co-creative approach, and I'll explain. But part of what I want to do today is talk about the methodology. It's obviously quite different from the methodologies that we've heard about so far. And I want to argue that there's room in poverty research for different kinds of methodologies. And I want to suggest that knowledge co-creation has an important role to play. But I'll do that through talking a little bit about our network and what we achieved. But part of what we wanted to do is to look at this whole question of knowledge co-creation. And also equitable partnership working, which I'll talk about a little bit as well. So you can see that our projects were located in the countries that I've mentioned, across those different countries. They distributed, the 67 projects were distributed across the countries, and they really dealt with, a variety of different themes, really interesting themes. So within the education for sustainable livelihood space, for example, several of the projects looked at the kinds of skills for employability, and often they focused on vulnerable groups, unemployed youth in South African townships, deaf and blind people in Rwanda, members of minority clans in Somaliland, members of lower castes in India, and so on. So we focused for the most part on the most vulnerable kinds of groups. We also looked at the kinds of skills that are important for achieving sustainable futures as well in that space. In relation to cities and communities, we looked at the perspectives. Some of the projects looked at what education looks like in urban spaces from the perspectives of the most poor and the most marginalized. What kinds of education do they think is valuable and important? What kinds of skills are needed to develop sustainable cities and communities? And, we had everything from food gardens to planting trees, but also food and water security. How does one sustain food and water security? Several of the projects looked at this kind of issue. So we had a real range of different projects there. I mean, some of them, for example, involved activists looking at how they can ensure water security in a context of drought, when the municipality is trying to cap their water usage and so on. The third space was education for climate action, and some of the projects looked at how you go about embedding education for sustainable development in the curriculum. Many of the projects looked at processes of social learning in communities. For example, we had a project in Somaliland which involved nomadic pastoralists. So we explicitly tried to draw on their indigenous knowledge, and they were facing a crisis because the enclosures that they were building for their cattle, they realized was through chopping down the trees was actually contributing to climate change in the region. So they devised alternative ways of building enclosures for their cattle, drawing on their indigenous knowledge. So we looked at how social learning goes on in those kinds of communities as well. So our approach was transdisciplinary, and I'll talk a little bit about that in a moment. It was also, so in other words, we sought to draw on quantitative and qualitative methods, but also on knowledge from different disciplines, whether it's sociology or geography or food science or whatever it was, or climate science, but also linking that up with non-disciplinary knowledge systems. And this is obviously the basis of transdisciplinary research. So in the case of the nomadic pastoralists, for example, we combined what we understood to be the climate science of change in their area with their own perspectives, indigenous perspectives, the kinds of changes that they'd noticed over many decades, and was part of their indigenous knowledge. And the same with the Adivasi communities in India as well. We pulled together scientific knowledge, what we knew about the climate change in the regions where they were, with their own observations and a detailed understanding of flora and fauna and what they'd observed in terms of changes. Our approach was also transformational in the sense that we wanted to change things. So rather than just describe things, we wanted actually to empower the people involved to make a difference, to try and transform processes, policies, cultures, structures, practices, and so on. And you'll see from the video I'm about to show you in a moment how we got on with that. And it was transgressive in the sense that we didn't just want to transform, but we also wanted to disrupt unsustainable patterns of development as well. But that's what I'd like to do now is I'd like to show you a video, if I may, which is our legacy video. So let me just, I'll stop sharing that and see if I can share this now, which is the video, I hope. And let me see if I can expand it. Lauren, can you see a black screen with the number 2 on the top?
No, I can't see a screen share at all at the moment.
Okay. And now?
Yeah, I can see a black screen. I can't see the number 2, but I can see like a video screen.
Hopefully this will work. To be able to
That's working.
Say about what we did in TSF and what we found out. We funded 67 projects altogether in India, Rwanda, South Africa, and Somalia, Somaliland. And those projects looked at the relationship between education and sustainable livelihoods, sustainable cities and communities, and climate action. So we recognize that the kinds of problems that we're dealing with, they're so complex that they can't be solved by academics alone. We need to bring in the perspectives, the voices, and the agency of those who are most affected by these issues. And I think what is special and distinctive about our approach is that we adopted a co-creative approach.
We have been very careful in terms of handling power dynamics and also ensuring that everyone is equal and everyone has equal voice. I think power of dialogue is significantly underestimated in thinking about solutions.
It's been an experiment really in knowledge democratization, involving not just university-based researchers, but teachers in schools, civil society organizations, and students themselves, and out-of-work youth, and other stakeholders in the different national contexts we're working with. And these are very often voices whose perspectives are marginalized and don't feature in dominant narratives around education and in existing research evidence.
Knowledge can come from anywhere. Knowledge is created around the kitchen table, under a tree, in the marketplace. Knowledge is created everywhere. We would have conversations about how do you foreground the marginalized voices of people who might, be illiterate or who might not be able to speak English, who struggle with accessibility.
So the problems that these projects are dealing with are very real. They're very visceral. They really affect people's lives in very profound ways. Whether we're talking about the problems of youth unemployment, or whether we're talking about unsustainable cities, overcrowding, people living in informal settlements, a lack of services, or whether we're talking about the effects of climate change, whether it be drought in the Horn of Africa or flooding in South Africa, Rwanda, and India. These are very real problems. And cutting across all of these kinds of issues are major inequalities that have their roots in history, whether those are based on class and clan and caste, but also inequalities based on gender, on rurality, or whether it's the kinds of inequalities that are experienced by indigenous communities. Education has a potentially transformative role to play in addressing these problems, but if it is to do so, then education itself needs to be fundamentally transformed. So these are the kinds of issues that we try to address through these 67 projects.
My experience has been the enormous strength and enthusiasm from each of these projects and the objectives that each project had to address. These were concrete objectives addressing relevant contextualized challenges that we have.
We've seen women's groups being able to, voice their particular interests in how they would like to see things change in their communities. We've seen activist organizations being able to mobilize more strongly amongst their communities to strengthen water security, for example. We've seen children in schools being able to grow food for their families and to bring communities into the schools. We've seen teachers being able to teach differently.
Some of the programs that we have funded worked with informal traders. 99% of transactions take place over mobile money to a lady who was selling fruits and vegetables. And she would say to you, you need to give me 20,000 shilling. If you send 2,000, she couldn't differentiate. These individuals are now able to read and write and do basic maths. To those individuals, that was a life-changing experience.
So it's been a very interesting process. I think some of the most important outcomes from the project that we are seeing has been coming to understand the type of research that we need in our institutions today.
To look at how we make research about relationships, about the co-creation of knowledge, about the development of really diverse partnerships, and maybe making research look like something that might not have been seen before.
It allowed us to get in some of the best young minds, energetic minds, so that we facilitate this idea of knowledge co-creation. And believe me, they are now agents of change. They understand how to bring these multiple challenges and issues together.
So through TESF, we've had this unique opportunity really to find out more about the kinds of structures and processes and supports that are needed and that can be put in place to enable the democratization of knowledge.
And I think it's the building of relationships and the building of connections and the, being able to empower communities. I think that's probably the most important legacy of TESF.
I myself and my team here in Rwanda, we've even built our own capacities and believing that we can do this one together, and we are into it together to create a better world for people.
Everyone empower each other. You see the local leaders empowering academicians with their knowledge. You see local people empowering local leaders, sharing the experience. Then everyone was empowered through the process of creation.
So what we have created has the power to catalyze many, many significant changes on the ground because of the sheer power of our assembly. It has ended up becoming this beacon of hope.
So hopefully that gives you a sense of our project. And just to conclude, I just wanted to make one or two points about the knowledge co-creation process. So, I've suggested that it's a great way of empowering people because the communities that are supposed to benefit from the research are actually involved in framing the research questions. And that can go for quantitative or qualitative research. They're also involved and empowered at different stages of the process. And of course, that involves genuinely involving people means that you have to overcome power relationships that are endemic between academics and non-academics, but also between different disciplines and different methodologies. You have to allow the time and space for people to explain and to understand from their own points of view different approaches to doing research, different ways of framing the problem. And in contexts like South Africa, you also have to overcome, deal with the emotional legacy of apartheid and of racism and of different kinds of inequality in different settings, which can provide a barrier towards really getting access to people's voices and experiences. So all of these things provide challenges. As universities, we're not very good at working with our communities. We tend to live in our ivory tower and do research on communities rather than with our communities. So we need to be epistemically humble. We found that we needed to be open-minded and learn from our indigenous communities about their perspectives on the nature of reality and the problems that they're facing. But it's also a means we found for thinking about decolonization, how one can decolonize the study of policy through bringing in different knowledges, different ways of perceiving poverty, understanding it, measuring it, and so on. So all in all, we felt it was a very important approach for us, but one that was replete with challenges. But if you'd like to find out more about TESEF, please do visit our website. And you can see it. I'll just share my screen here so you can see it. But we do have a wonderful range of resources that can be accessed, including the calls for action, the reports from the 67 projects, which report on the empirical findings. We also have, so that's an example of a call for action that we developed about, in this case, ethical partnership working. We also have written up our approach to knowledge co-creation. So those of you who are interested in this particular approach, please do have a look at our website, and hopefully you'll find information there that will be of interest to you. So my time is up, so I'll stop there. But thank you very much for listening. And now we have an opportunity for some questions and discussion from the audience. So Bongai Munguni is asking, yes, it will be great to see more collaborations between communities and researchers, or even hosting research conferences in rural communities, for example. This might help in understanding the poverty problems and speak with the people living in poverty about possible solutions. I couldn't agree more, Bongai. That really was our experience. But it does raise challenges. So in the case of the nomadic pastoralists, for example, in Somaliland, we were lucky because one of our researchers in Somaliland is from that community. So he speaks the language, but he had to travel 200 miles. There was no way that we were going to get the nomadic pastoralists into a hotel room to talk about poverty. We had to go to them. So he went and he sat under a tree. You saw it on the video, sitting around a tree, discussing the research with them. But that's absolutely right. I couldn't agree with you more. So colleagues, we've had 4 interesting presentations. Please feel free to ask if any more questions from the audience. Okay, Shaylin, Hi, Shaylin. You've got a question for Nkechi. I can't actually see what the question is. Okay, all right, here it is. Is it a case of large households, Nkechi, or the relative share of kids to adults? Over to you, Nkechi.
Thank you for your question, Shaden. I'm assuming you're asking about when I reported the results that household sizes, larger household sizes appeared to be more at a risk for food insecurity. Okay, if that is the case, well, then the answer to that is that yes, this was relating to larger household sizes. There were no distinctions between the dependency ratios within these households. So it was just a variable that was representative of the size of the households. I hope this answers your question.
Thank you. Yes, that's great, Nkechi. Okay, please do come forward with your questions. Whilst we're waiting, I've got one for Cynthia. And Cynthia, it's really to ask you, at the end of the day, were there specific colonial policies that you think led to the differences in the household, in your findings at a household level? And what were they?
Oh, okay. There were differences in the health and education sectors. Mainly at the household level, there were no colonial differences. Water, sanitation, poverty, information were similar between colonial contexts. However, for the health and education, these are state-provided goods. And so there is difficult to have a direct pathway because there must have been some endogenous variables that could have, masked the effect of colonialism. But however, the British were in their indirect rule, they welcomed missionaries more, which was supplied health and education to the poorest communities through their decentralization. So it was more favorable for them to infiltrate all the peripheral areas. Unlike in the Francophone areas, their centralized systems, it was more supplied by the government. And of course, the government was the French. Education was limited only to those who could speak the French language. So many people, most indigenes were not educated. At the time of independence, a higher number of most Africans from Anglophone areas were more educated than Francophone areas. So if we look at the supply-driven theory, at the time of, which is in this contemporary period, there's less supply of health and education services affordable to most of the indigenes.
Fascinating. Yeah.
Sorry, another thing about the health is the primary health sectors as well are more numerous in Anglophone areas than in Francophone areas, and primary health is the most affordable system of healthcare, which is lagging in Francophone areas. So this may be some policy differences.
Thank you so much for that. Very interesting. Dave, you've got a question.
Yes, my question is for you, Leon. As you know, I'm a fan of co-creation, and I've done a lot of work on trying to incorporate the views of the public into poverty measurement and policy solutions. But there are some traditionalists who are who are not so favourable to co-created research, who argue it's ineffective and unfocused. In what kind of circumstances do you think co-creation is strongest, and where do you think it's weakest?
Okay. Yeah, so I think I think in terms of where it's strongest, I think it's where you want to make a real difference in terms of practice, people's direct different changes to people's direct lived experiences of poverty, of inequality, where it can be used to increase the agency of the beneficiaries of the research through involving them in the research process, and in that way making the findings, I think, relevant to them. So we talked about the nomadic pastoralists as an example. There were also similar projects with Adivasi indigenous communities in India and with activist groups and in the Western Cape and so on. And you know, allowing where people have the scope to help to frame the research, then it can make it more relevant to people, I feel. And I think involving policymakers and practitioners as well in the mix in a project can also really assist in understanding the question of implementation, because if they're able to offer their insights during the research process into the practicalities of actually putting things into practice, then I think that helps really strengthen. So we saw, for example, in the greening of Garaway, which was a project in Somaliland about planting trees, how through involving the policymakers, now Garaway is a much greener city. They're able to scale it up because they were involved from the outset in advising. And there's all kinds of things you wouldn't imagine of being an issue. For example, in that context, the effect of goats, because of course goats, you know, they see a young sapling and think it's dinner time, you know. So having people that are used to dealing with those kinds of practical issues becomes very important. I guess, you know, there are different kinds, that some research questions, you know, depending on, I always think that the kind of knowledge that is relevant, whether it's scientific, technical knowledge, disciplinary knowledge, or whether it's local and indigenous knowledge, depends on the nature of the problem that you're trying to address. I don't think there's any situation where a co-creative approach would necessarily weaken that research either. So let me give the IPCC as an example. So the international, what does it stand for again, Dave? International Planetary Commission on Climate Change. Of course, they produce their annual reports, which are highly influential, and they kind of the main research that's found that people talk about in the COP meetings and so on. And of course, it involves bringing together climate science, you know, which is highly technical, highly complex, methodologically extremely sophisticated. And they've been trying to bring that together with indigenous perspectives on how you mitigate climate change, in particular. Also, how you might observe the effects of climate change. Indigenous communities have a lot of knowledge in that respect, as well as how to mitigate its effects. So I would argue that even in the case of something as technical as that, a co-creative approach can be helpful. I don't know if that answers your question.
Thanks. So the Intergovernmental Panel on Climate Change example is a really good one. Yes.
Yeah. Okay. Great. All right. Do we have any other questions, please, for the panel, the speakers? Okay, I've got a question in that case for Murray. Murray, I wonder the extent to which you feel the patterns of inequality that you observed during COVID have narrowed or widened subsequent to the pandemic in South Africa. and whether it's possible for you to say anything about that on the basis of your research.
Oh, that's a great question, and it really it picks up the story in a sense where I finished, because where I closed was the fact that this emergency relief grant that was targeted for the first time in our country at the unemployed and the informal parts of the labor market who had no protection through COVID, but they have no protection anyway, right? In the vicissitudes of the labor market, it's an extremely vulnerable section of our country, and thus far the employment creation issue has tended to be cast as a sort of, well, we need to grow. It's a growth issue, but it's not just a growth issue. And so the point is that the inequalities have widened, right? But because and they widen every time. So COVID represented something. If you look at the socioeconomics of it, it represented a shock that reveals the stresses that normal people have to cope with all the time. But it just gave you a very sharp picture of that. And so the very notion of emergency relief, which was essential, of course, but it opened up this issue then of, okay, but how do we actually support people in much the same sense that you were talking about, Leon, in their agency to actually cope with what life is really like in South Africa? And that's where the sort of the momentum, the Treasury being very, very anxious about the fact that they couldn't afford to mainstream, if you like, this grant to South Africans, the teeny little grant that South Africans have shown that they use incredibly well. The budget issues haven't won the day. Only the budget issues. The discussion that's come around. Okay, but entering into the labor market requires its own support. You can't get into the labor market if you're from particular vulnerable communities. So it's no point in building a growth thing without those links to people and their actual livelihoods. I think it's made a huge difference, actually, to the discussion, and it hasn't changed the inequalities at all, but there's a much more engaged discussion about the fact that it's not just the economists deciding on the appropriate sort of youth unemployment strategies, the necessity to link these two and ground the livelihoods of people with the economy. The economy is people at the end of the day. It's not direct foreign investment. And I think that narrative has changed a lot in a good way. That also then goes to policy prioritization. I guess that's the point. I think the momentum is so strong that when people say, okay, but the budget just doesn't allow the stuff, the argument is, okay, but then we need to reprioritize what we're doing. Much like your education research, it opens up all sorts of avenues to do things differently, right? To cope with sort of structural budget, austerity. You can also cope with it by doing what you do much better in much more joined up ways. It saves money and it actually has higher impact, So I think the notion of the policy discussion in African economies around climate change and around these sorts of issues has changed quite a lot in terms of, okay, this is not non-negotiable. The question is, how do we do this? We've got to. We can't do policy, education policy, or anything else, land policy, water policy, the way we were doing it before. We've got to do it in a better way that links this thing up. So I think there's a sea change in the way, the way we're configuring these things. It doesn't suit the politicians, though. So there is the political economy of this, And so when I was listening to you, I was wondering about whether your engagements with the local officials, for example, around gender issues in the African context, it's not always plain sailing, because these inequalities are very prevalent, but those who've been speaking on behalf of the gender issues aren't always the right people. Anyway, so I've ended up tabling a question by finishing my answer. Thank you.
No, that's fascinating, Murray, and let's hope that those lessons, have been learned. And I guess we'll see soon with the new coalition government whether they're able to actually action them. And heaven help us if there's another pandemic. But let's hope that they have learned from the last one. But no, the point about your question there at the end is very interesting. So one of our projects, for example, we funded some activists in the Northern Cape who were keen to push back against some of the mining interests that were coming in, because they felt that they were polluting the land and damaging their livelihoods as their fishing community. But before they could organize against the mining interests, the women had to first of all organize against their own menfolk. They used the resource to really advocate first of all with their menfolk, and the community at large, around why these issues are important and why their voice as women is important. And then that provided a foundation for them to then talk to the mining interests. So yes, it's a very good point that you make, and to be constantly reflexive and aware of these power differentials is crucial. So, but I wanted to just extend a little bit, if I may, some of your comments. I wanted to ask Nkechi, in your presentation, you gave us a very nice map of the links between climate change and poverty in a very clear and accessible way. And I was wondering, following on from Murray, what the policy implications are for you from that analysis and the extent to which you feel they've been taken on board.
Thank you for that question. I think that one of the main takeaways I wanted to provide from this research was to just provide a way of just a visual picture of not just where we see food insecurity spread out across the country, but also since these shocks, as I've shown, are becoming more and more common across the country, have a policymaker or someone who's interested in these issues look at the map of Ghana and be able to see clearly where we have these overlaps in food insecurity, but also in climate shocks. When we think about climate shocks, oftentimes we think about other things that are important to deal with. But I feel as if as climate change is becoming a real issue, it's something that should be presented to policymakers in an accessible manner, so that when we talk about some of these interventions or programs that need to be rolled out to make it easier for these individuals to adapt better to these disaster events, it is not a complicated thing to decipher. It's just simply you could see the clear north-south divides with respect to which areas of the country are seeing so many of these shocks and are also food insecure. So this is really early research. I haven't yet shared it with policymakers. Indeed, this is one of the very few opportunities that I've had to share this research, but I'm hoping that in a few months' time, I should be able to take it to, policymakers and hopefully get some buy-in from this type of work, because I think that it has very important implications for policy. It has important implications for even the distribution of resources across the country. There's a reason why a place like Accra experiences these shocks, but they somehow have some of these supportive infrastructure and interventions that make these households not so exposed, if you will, to the effects of these shocks with respect to food insecurity. So I think that it's we keep on talking about some of these issues, the importance of making some of these programs and interventions accessible to everyone equally across the country. And this is one way of showing that, look, it's something that's worth paying attention to. This is the picture. So if we are thinking of, trying to increase, the adaptation of these households to these events, you want to focus, we have limited resources. Accra, it's great to focus it on Accra, but just keep in mind that there are other areas of the country experiencing these issues and are not as supported, if you will. So that's the main takeaway that I'm hoping to show with this.
Wonderful, yeah. So you began to hint there a little bit around some of your hunches around why perhaps in somewhere like Accra, the effects aren't felt so acutely. But I wonder if you, through your research, you identified any other mechanisms for mitigating the effects of climate change in some of these more remote, rural, poorer areas in the north?
So I think that, we already have, as I mentioned, the Livelihood Empowerment Against Poverty program. We do have that in Ghana. And we tend to target, or the program targets particularly poor households. I don't know now to what extent it is targeting those households, those poor households that also may be experiencing climate shocks. And I feel as if in this scenario, in addition to, poor households, perhaps some of these support is also benefiting those that are experiencing those shocks. But, I feel as if this isn't specific, it's targeting poor households, but I feel as if this additional layer of those who are experiencing these shocks should also come to bear. And also, even when we talk about the Livelihood Empowerment Against Poverty program, there's currently some issues with targeting, right? There are a few households that are poor, but currently don't receive some of these interventions. So again, it's throwing a spotlight on the need to, properly make sure that we are capturing all those who might be, who might be in need of these types of interventions. But in addition to the LEAP program, we also have, quite a few NGOs whose works are more targeted to communities that experience some of these climate shocks and events. And I think that this is why when I showed the results from the regressions, we see that perhaps there's some cushions already being provided, which is great. But I think that there's still some room for improvement in this regard. So that is also meant, this research is also meant to highlight this in trying to mitigate some of these effects on these poorer households.
Yeah, fascinating stuff. We've got another question for you, actually, from Shaylin. So the question is, do you see the same patterns overlaps with individual level outcome measures of undernutrition? For example, child wasting and stunting?
That is a great question. And Shaylin, you know that this is an agenda that I hoped to continue after this first paper on household level poverty. So that is, you're sort of getting into my new research that I'm currently involved in. I only have preliminary results, but I'm happy to share a little bit more once I've concretized some of what I'm finding. There is, again, very important linkages, I will say at this point. But keep in mind that when we are talking about some of these climate shocks, it will have to be at the district level. Food insecurities at a household level. So I'm looking at average childhood outcomes for the household level. And I'm finding, again, very important connections between shocks and also child malnutrition in the Ghanaian context. So I'm happy to, perhaps I'll be invited to another presentation. I'll be happy to share those results in a few months. But I think that this is a very interesting research agenda that, if it isn't brought to the fore, we end up missing. Right? These shocks are happening particularly in the northern parts of Ghana, where there's not a lot of support. And I feel as if research like this can help to shine a spotlight, food insecurity, but also what's happening with children's nutritional status. So thank you for that, Shaylin.
Yeah, no, thanks. And Shaylin's smiling at you in the chat. So he's appreciating your answer. Murray, you've got a question.
It was just an input, really, to follow up on your engagement with Nkechi about okay, how does one push the research then into optimal outcomes that support people, and I think what we've been finding in our collaborative projects, particularly around climate change, but also spurred by COVID, is that the first margin is that, like the maps that Nkechi showed, one can map those and map all the research onto the commitments that have already been made by government, right? And governments, the Ghanaian government certainly, but the South African government as well, they make a big deal about the stakeholder engagement part that's supposed to have been alongside their commitments then into Paris or into somewhere where they make commitments on behalf of their countries, to respond to climate change. And one way of opening up the issue is to already show the dissonance between the livelihoods of people and what they've already committed to, So that's the first line. But then the texture of, if you win that argument, then people say, okay, but what are you proposing? And that's where the mechanisms at stake around abused concepts like resilience, what are we actually saying? That's where your type of work, Leon, along with more difficult work around the dynamics of livelihoods, becomes absolutely crucial. That you actually do have something to say about, okay, but these are the community priorities as they navigate their lives. You've got to be able to say something as well as criticize policy. But I think you can do both at the same time. Yeah.
Yeah, that's really helpful, I feel. And I would agree with you. I think that's a nice way of looking at it. I think there's room for different kinds of methodologies to try and solve these intractable problems. We need to use different methodologies. Okay, so that's great. We're almost at the end of the session. I could carry on. I've actually got lots more questions I could potentially ask, but we're going to have to stop here. And I'd like to take this opportunity to thank our presenters today for some really wonderful, well-prepared, thoughtful presentations. And I think we got a sense at the end there of how the presentations cohere through the question and answer session. So I would like to thank everybody, each of you, for your presentations. I would like to especially thank the audience as well. Thank you for coming and listening to us and for your questions. And I'd like to thank Lauren for facilitating this discussion today. And of course, Dave, for your wonderful work in leading us through the work of the Bristol Poverty Institute. I think, as Murray was saying earlier, the quality of these presentations really is a reflection on the Institute as well, and the kinds of partnerships that you've been developing over many years now. So thank you for that. And so go well, everybody. And let's hope that our paths cross in the very near future. I know I very much want to be in touch with you going forward. So thank you again and take care, everybody.
Thank you. Bye-bye.
Bye-bye.
Thank you so much. Cheers.
Thank you. Bye.